So hello everyone, my name is Dr. Vikram. So today I'm going to speak about age-related macular degeneration. So it is a very upcoming and very serious eye condition because it is affecting a lot of population in our country, and it especially affects anybody who gets older. Mostly anybody who is getting above 50 years of age is getting affected with this, can get affected with this. So age-related macular degeneration, what does it cause? So usually it causes central vision problems. And age-related macular degeneration, two variants of age-related macular degeneration. One is called as dry age-related macular degeneration and the other one is called as wet age-related macular degeneration. In the dry form, it's a very slow growing, slow process. But what happens in that is, so normal waste materials which are created in the retina, they have a passage through which they get absorbed, they go under the retina and from there they get absorbed. But in age-related conditions, what happens is the clearance of the waste material is affected and then it gets deposited in the center retina. And since it is a waste material, it causes damage to the nearby cells and which causes loss of central vision. So many patients present with they can't see the central area because the central retina gets thinned out because of this age-related macular degeneration. So the other form is wet age-related macular degeneration. So wet form, unlike the dry form, which is a very slow process, the wet form is a very serious sight-threatening condition and can develop very rapidly. So the main problem with wet age-related macular degeneration is there is growth of new blood vessels under the retina. These blood vessels are very leaky, they cause leakage, they cause accumulation of blood and fluid in the retina and as well as under the retina, which causes again the central vision problem. So luckily, since about 20 years ago, there was a very remarkable invention which was made, that is anti-VEGF injections, which can cure these conditions. Unlike dry form, which still has no treatment, the wet age-related macular degeneration has multiple treatment options. Most commonly are anti-VEGF injections. The anti-VEGF injections are also, there are very different types of anti-VEGF injections, and with successive ongoing years, the research has been so much that the newer anti-VEGFs are which we call as the second generation anti-VEGFs, have a very good effect, a very good response and a prolonged response. So the common symptoms, of course, as I discussed, there are two forms, dry and wet. So the symptoms also depends on which form you are having. So if somebody is having a dry age-related macular degeneration, so they get central scotomas. By central scotomas, I mean center vision gets affected and you see black in the central area. A person is not able to see somebody's face, or is not able to read the letters because he can see the surroundings, but the center vision is not seen. So similarly, in the wet age-related form macular degeneration, it also affects the central retina, but here the first symptom is the vision gets blurry, the lines may get wavy. So the wavy vision, we say, is as the first clinical symptom of wet age-related macular degeneration. If you see these changes, better to see a specialist as soon as possible. So anybody who is above 50 years of age is at risk. So genetic factors are also responsible for this. So anybody who has a family history of age-related macular degeneration should particularly get his eyes checked after age 50 years of age. So current diagnosis, of course, first is with patient's symptom, and when we examine the patient, we can see there are patches on the retina, we can see some blood patches on the retina. Then next, the best tools, then we go to investigation. Then there are two main investigations. One, the hallmark is now the OCT. It is the standard test which can detect the layers of the retina and can detect which layer of the retina is affected. And then we have angiography. So one is traditional dye-based angiography, in which we inject a dye and we take photographs of the eye. So it is very similar to a cardiac angiography, but it is just an eye angiography, and we just take photographs of the eye. Recent developments in the recent years is now there is a dye-less technology also which is available with us as well. So that is OCT angiography, no injections or anything given. We just take a photograph of the eye through OCT machine, which is a very new technology, and it offers a detailed retinal structures. So main treatment option is, of course, anti-VEGF injections, as I discussed. In some of the cases, laser is possible, but that we decide after doing an angiography or an OCT angiography. But mainstay of treatment is anti-VEGF injections, and these injections, only problem with these injections right now is that we need to give them multiple times. the disease is almost like diabetes. So if you've got it once, it's not going to go very soon. So you will need multiple sessions of therapy. You will need multiple anti-VEGF injections in the eye. So initially we give monthly injections, and about 3 to 4 injections later we can switch to either 2 monthly, 3 monthly, depending on patient to patient. So that is the main hallmark of the treatment. So if you are above 50 and if you have family history of age-related macular degeneration, it is utmost importance that you get your eyes checked annually at least, and so that we can detect the disease before it causes any major visual problems.